So when we do an assessment, we are first evaluating the patient's history, how their pain started, and how it's progressed through times, what type of medication they're taking, if there is other type of medical conditions that could be contributing to their condition. We assess where they're hurting, what type of pain they have in their head and neck area. And then from there we go on to measure the range of motions, because that's how we measure whether the patient is getting better or not, is to establish a baseline and see what range of motions they have for their jaw, for their head and neck area. We follow through with a joint vibration analysis test. It's a machine that looks like a headphone that measures the vibrations the joint make in motion, and from there we can assess what type of, through those vibrations, what kind of conditions we have, whether it's soft tissue vibrations or bone-on-bone, hard tissue vibrations. We do a muscle palpation exam where we get a baseline of where they're hurting and how badly they're hurting in different places of the muscles of mastication of the head and neck area. We also we do a cranial nerve exam, more of screening to make sure they don't have any cranial nerve deficits. We check the motor reflex tests to see if there's any parts of the body that are contributing to a postural instability, so we can address that, or if it's coming from the joints, or know where to refer the patient, whether they have back problems coming from the spine or feet problems. Our tests can determine the source of that pain, and so we can treat it and help the patient recover better and faster.